Welcome back to another Bali COVID-19 update, and this is for August 18th, 2021, and happy one day late, Independence Day in Indonesia, August 17th. A quiet day though, unlike usual. No children around, no bands, no cheering, well, the flags are flying, but well, this is Independence Day COVID style. And so, before we get to the numbers, what about the restrictions, right? Our weekly news report came from Buleleng again, and restrictions, to nobody's surprise, have been extended for one more week until August 23rd. And, well, this is a weekly thing. How long is this going to go on? Nobody knows. Where's my crystal ball? Okay, so Buleleng said that the details will be announced shortly, and so we're waiting for the details. I was waiting for the Monday night press conference or news report. It was actually not a press conference, video call. And so, how many times have they been extended? This is the 5th time. So first it was, first they were called the emergency restrictions, and then it was changed to PPKM level 4. And so first one was from July 3rd to July 20th, and then the 26th, the 2nd, and the 9th, and then yesterday. And so the restrictions have been easing up, and so I'm waiting to see if there's going to be any more easing up, but I haven't heard yet, and I will add this here if I get any more details before I upload this. Okay, so this is Wednesday, and I'm getting ready to upload this in just a little while, and so there is a little update here, a little clarification on the extension of the restrictions. So there's been some flexibility because of the decline in COVID cases, so there's going to be a greater capacity for malls, restaurants, and places of worship. And malls, worship places will be allowed to receive visitors up to 50% of their capacity. Previously it was 25%. Mall visitors are going to continue to have to show their vaccination status, and they can use the Buleleng app. According to Buleleng, the mall reopening trial with the scan, the check, has been good, with more than 1 million visitors checking into the Buleleng app for entry into the malls. So, okay, coming soon to Bali? Probably. Okay, let's go on to the numbers. Okay, so what are the numbers? Well, good news, good news. We've got 2 days in a row, we've been less than 1,000. Now, we have to remember that this is a holiday weekend, long holiday weekend, so numbers usually go down, but hey, let's not look a gift horse in the mouth. So, yesterday, what did we get? We have a 7-day average of new positive cases has dropped down to 1,325, good news. The 7-day average deaths, however, have gone up to 41 a day. Okay, that's not good. What about in Indonesia? Indonesia, we're at 20,741 new cases. Okay, so another good sign. We're getting close to getting below the 20,000 mark. And remember, we are way up, like at 50, not that long ago. 1,180 deaths. So the deaths are down a lot too. So, okay, let's say that the numbers are looking good. For the whole country, test 101,400. So you see the test numbers are way down. 20.4% positivity rate. So that's good. That's going down too. And what about in Bali? First doses for vaccinations, we're at 72.1% with 3,114,467. And second doses all the way up to 33.1%, 1,429,683. Wow. Okay, so we're moving up quickly. 26,501 additional doses yesterday. And so positive cases 988. Now yesterday it was 800 something, but remember it was 1900 and 1700 just a few days before that. So this is good. Recoveries 1,037, deaths 48, and active cases down to 11,206. So all this is good news. Out of the 988 new cases, all of them were Indonesians. 820 were local transmissions, 159 domestic travelers, and 9 from international travelers. Okay, still have a lot of cases from domestic travelers. And what about by regency? Denpasar 293, Badung 179, Gianyar 133, Tabanan 117, Buleleng 85, Klungkung 58, Karangasem 46, Jembrana 42, and Bangli 32. So, good news, and I'm feeling really positive about this. Maybe I'm grasping at straws, I don't know, but the numbers are down. Even if it's a holiday weekend, we've got the numbers down. And the skies are, well, it's actually kind of cloudy today. Maybe that's good news. We get these bad numbers, it always seems like it's a nice day. Today it's cloudy and windy, but well, there's sun out too. Anyway, okay. So, good news for the numbers. And vaccinations are ongoing, so I'm not going to talk about vaccinations today. And we're going to skip right over to something that I talked about the other day. In the last video, I said that I would discuss the question, will this ever end? And because for many of us, this seems like dystopian future is unveiling right before our eyes, where we'll be forced to wear masks all the time, show identity cards when we want to enter any kind of facility, a restaurant, a shopping mall, government office, an airplane, identity cards with our health status on that can be scanned, only gather in small groups and work, learn, and love online. Yeah, it seems like a dystopian future. Can we get rid of the coronavirus? Well, according to an article based on analysis of experts from New Zealand, the short answer is yes. There is hope that COVID can be eradicated, but the scientists did a meta-analysis of data of past studies and looked at comparisons with smallpox and polio. And so they said, yeah, it can be eradicated, but it is not going to be easy. The study noted that some nations were able to temporarily eliminate the virus before vaccines were released by using border control, mask wearing, physical distancing, testing, and contact tracing. So those things need to be done on a continual basis. And what about efforts with past diseases? Well, smallpox was completely eliminated in the 1970s after being around for 3,000 years. This was accomplished by a worldwide vaccination campaign, and polio has almost been completely eliminated, with cases of the wild polio virus decreasing by 99% from 1998 to 2018. Okay, so we got rid of one, and we've almost gotten rid of another one. So how did the scientists go about analyzing the data? They created the 3-point scoring system from 17 elimination variables, some being the availability of a safe and effective vaccine. Okay, we have that. How long it's effective, we don't know yet. Lifespan of immunity, impact of public health measures, and effective government management of infection control messaging. That's been lacking in a lot of places. So looking at the 17 variables, they found that COVID-19 scored 28 points out of a total of 51, compared to polio, which scored 26 out of 51. So they said that when they look at the variables, they're not looking for a perfect score. They have to have a lot of elements in place in order to consider eradication as feasible. And so, according to their preliminary analysis, COVID-19 eradication seems slightly more feasible than polio, but much less so than for smallpox. What are some of the challenges to eradicating the virus according to the study? 1, vaccine hesitancy, and we've got that everywhere in the world. 2, the rapid evolution of viral variants that can outrun global vaccine programs. The high cost of implementing vaccination programs and upgrading healthcare systems. And wild or domestic animals serving as a reservoir in which the virus might mutate further. So those are problems. And what about the benefits? Even if we can't completely eradicate the virus, if it's going to become a regular thing that people are going to need to have booster shots yearly, well, the upgrading of healthcare systems could have benefits for controlling other diseases as well as the virus. Now, that's something that could occur around the world, and we see efforts being made in many countries in terms of improving the healthcare system now. So the authors concluded collectively these factors might mean that an expected value analysis could ultimately estimate the benefits outweigh the cost, even if eradication takes many years and has a significant risk of failure. So there's something positive. Okay, we could see the end of this. And so we may be able to eradicate the virus eventually. We may not. And so this article, Living to Learn Endemically with COVID. So the health minister said that President Jokowi wants his administration to prepare 2 roadmaps to consider ways in which we, the public, can learn to live with COVID. The goal is to work out a plan where the national economy continue to operate safely and normally. The health minister gave an outline of how the health protocols will be implemented and enforced by using digital means. And the sector of the economy that he mentioned, modern retail outlets such as malls and department stores, traditional traders, wet markets, grocery outlets, office space and industrial areas, land, sea, and air transportation, hotels, restaurants, events, and other tourism enterprises and educational institutions. President Jokowi wants the health protocols created and enforced using digital information systems that allow daily activities to proceed in a normal way. Yes, okay, I'm looking forward to that. And according to the health minister, this is going to work by using the smartphone-based application Peduli Lindungi, and if you're here and you've been vaccinated, you've already used it, I'm sure. And the minister said, we're planning a pilot project starting next week in several malls working with the Indonesia Association of Malls. And that's already apparently started from what subscribers said the other day in the comments section. And the minister also noted that this is being integrated with air transportation as well, so that when you check in for a flight, vaccination and PCR swab tests will be digitally and automatically revealed. And so I was talking about the dystopian future. Well, we're going to have these cards. Do I think it's a dystopian future? It's not something that I'm real crazy about, but if it's a way for us to get back living normally, yeah, I'm willing to have somebody scan my barcode and see if I've been vaccinated. So, I talked about Pak Luhut being here and being not happy with the way things are going here in Bali. And so, next couple of stories about what's happened since he's left. First, when Denpasar officials turned 5-star hotel into COVID-19 quarantine facility. So the officials from the Denpasar city government have turned the 5-star hotel in Sanur into a COVID-19 quarantine facility as a response to the recent instructions from the central government to accommodate all asymptomatic COVID-19 patients. And in the Indonesian article here, I translated, it said, after being scolded by the coordinating minister for Maritime Affairs and Investment, Pak Luhut, along with Minister of Home Affairs and Minister of Health. So since Pak Luhut's visit and his, rather blunt comments, the Denpasar mayor, Pak Negara, stepped up centralized isolation area for residents who were confirmed to be asymptomatic. And so he turned the 5-star Hotel Grand Bali Beach in Sanur into a quarantine facility for asymptomatic patients. And well, if you've been in Bali a long time, or even if you've just visited, you know that the Grand Bali Beach Hotel was back from Pak Sukarno, our first president's days, and well, it's a historic building. The hotel is expected to be able to accommodate around 250 patients. And according to Pak Luhut, the central government believes that centralized quarantine program is a solution to preventing COVID-19 transmissions to surge through family clusters in Bali, and that certainly makes sense. I believe the same thing. In addition to the Grand Bali Beach Hotel, Pak Negara said that other hotels and several government buildings are going to be added to the official quarantine facilities in Denpasar. And that's great. And you might remember from the past video I said I had a close family friend, well, actually a family member, tested positive and was told to go home to quarantine, where there are 4 other family members, including 2 children. Not the ideal way to deal with the situation. In addition to increasing quarantine facilities, the mayor also plans on optimizing testing, tracing, and treatment, the 3T program, and is going to deploy more officials in order to implement this program. Good, get more people out in the street. He concluded, we really hope we can get a better handle on COVID-19 transmissions in Denpasar through these efforts, and good luck. I'm looking forward to a drop in cases, and as we've seen, numbers are starting to trend down in Bali, so maybe all of this is actually working now. And more on the results of Pak Luhut's visit, and this article, thanks to Luhut, hundreds of Buleleng residents mobilized to centralized location. Okay, so the centralized quarantine facilities, this is the big thing. The Buleleng COVID-19 Handling Task Force is mobilizing residents who have been self-isolating and moving them into centralized isolation facilities. Previously, before Pak Luhut's visit, residents were allowed to carry out isolation for reasons of convenience. Now, all residents who've been exposed to COVID-19 with no symptoms must perform centralized isolation. So this past weekend, teams were out from the Army, the Police, Transportation Service, Regional Disaster Management Agency, Civil Service Police. They were all out getting vehicles and moving people into facilities. The Deputy Regent of Buleleng stated that the task force no longer will allow residents to self-isolate. They have to enter a centralized isolation location prepared by the government. There will be a few exceptions. For one, mothers who have just given birth, also seniors who need special assistance and care. They can self-isolate. But, he said, we remind the health workers and village officials to monitor. He added that from evaluation results, the task force found several cases of self-isolating patients dying at home. Also, he said there's a lack of discipline while undergoing isolation. He said we cannot guarantee those who are self-isolating are disciplined because we can't keep 24 hours at this house. Okay, that's my translation, because we can't keep watch of these houses 24 hours a day. And so that's one of the reasons why people have to be moved into centralized locations. And you remember a few videos ago, I was talking about people who have been tested positive and were supposed to be self-isolating, who were out wandering around the community. The Deputy Bupati said that the government has prepared all necessary facilities, such as exercise facilities, food, vitamins, medical supervision, and free internet network. Okay, so they've got something to do while they're there. Good. And so another positive result from Pak Luhut's visit. Okay, so it seems to have lit a fire. As I was mentioning the other day, if it's got the authorities at the level of Denpasar and in all the different regencies, getting people active and getting them out doing things, especially the quarantines, and hopefully tracing and implementing the safety protocols like wearing a mask and social distancing. I came across this article, and a subscriber also put a link to it the other day. The National Hospital plans to boost Bali's economy through medical tourism post-pandemic. Great. Okay, medical tourism is something, I've said many times that we need to diversify. Medical tourism is kind of in between. It's still tourism, but it's medical tourism, a little different, and it's being done all over the region. Singapore, Malaysia, Thailand, especially Thailand. I've gone to Thailand for medical vacations before, and Singapore as well. So good to see that somebody is working on this. So the National Hospital from Surabaya is planning on supporting Bali's economic recovery through medical tourism after the pandemic is over. And this is being pushed by the Bali Medical Tourism Association. I didn't even know we had a Bali Medical Tourism Association. So I was pleasantly surprised to hear that somebody's involved in what can be a really lucrative source of revenue. The head of the association, Dr. Gov't, confirmed that in order to optimize the health industry in Bali, he's invited the National Hospital to get involved. And he hopes as well to work with local hospitals to provide treatments for patients with conditions such as Parkinson's and movement disorders, aneurysms, varicose veins, stroke, comprehensive epilepsy, laser rejuvenation, and comprehensive brain and spine treatment that meet international standards. Wow, okay, so some stuff that I could use. And I've been hospitalized a number of times in the past 32 years here for a variety of things. Most recently, well, now, 10 years ago, strokes. And I was medevaced once to Singapore the first time. I wasn't real crazy with the treatment there. And then the second time here, and I went and saw a neurologist at Siloam. And Siloam gets some bad reps from people, but for me, it's been great. I have no complaints about Siloam, and what they did after my last stroke was really, really impressive. So, medical tourism, okay. And the National Hospital has officially opened its first PCR laboratory in Bali to help Bali in preparing their COVID-19 screening procedures before the reopening. And we haven't heard from our old friend, Pak Sandiaga Uno, the Minister of Tourism and Creative Economy. He's been unusually quiet recently. At a webinar this past week, Pak Sandiaga Uno said that there is going to be an extraordinary tourism explosion after the implementation of restrictions on community activities, PPKM, after it ends. He said he came to this prediction because people are going to want to travel and buy creative economy products after going through this long period of not being able to travel, staying at home, being bored, saving up some cash maybe. He said that the stakeholders in the creative economy and tourism have to be ready for this explosion. And so he invited them to carry out various transformations towards digitalization. Additionally, he stressed prioritizing health protocols after restrictions end so that we can be ready to face the worst possibilities. Okay, good. I'm all in favor of that. Pak Sandiaga Uno hopes that in the second half of the year, after the PKM4 ends, tourism and creative economy sectors will grow by 2.39%. I don't know how he came up with that number, but he said this sector, the tourism sector, will be able to reabsorb the workforce, and so he said we invite all parties to jointly carry out the 3 Gs. The first is fast movement, the second is joint movement, and the third is working on all potentials to survive and rise. And he concluded that even though foreign tourists cannot be expected to come here, so he hasn't mentioned anything about when we're going to open up. I noticed that. He said the visit of domestic tourists is a large opportunity and is highly expected to revive tourism in the creative sector once the restrictions end. And so, okay, there's something positive. Okay, he's not coming up with a date for we're gonna open in September. He said we realize that we're not going to get them here now, but once we do open up, we're going to get a lot of people. Unfortunately, it doesn't look like a lot of Australians, but we'll have to see how it goes. Okay, time for a wrap up, and what if the numbers are positive nationwide and in Bali? Are they going to stay like that tomorrow? In the next day? I don't know. We'll see. But they're definitely down a lot from the high the other day. So that's really, really good news. Maybe things are working. I hope so. And more people have been isolated, put in central locations for quarantine. That's good news as well. We need to have less people wandering around. In terms of the restrictions, are they working? Okay, could be. If the numbers are going to come down, maybe that's one of the things that's working. Maybe it's the vaccinations. Maybe it's a combination of both. Mask wearing. So I was out this morning, had to go to the dentist, so I went through about 6 different kampungs on my way there, kampungs and banjars. And on the main roads, almost everybody masked up. Anybody that wasn't was really obvious. But once I got into the kampungs themselves, yeah, almost nobody was masked up. So if you've got a case in a neighborhood, in a kampung, in a banjar, nobody's masked up, yeah, it's going to spread. So, you know, that part is not working, and the government keeps saying we need to be disciplined, we need to be disciplined, we need to be disciplined. We do need to be disciplined. Because I want this over, like everybody else does. I want to see my youngest daughter, who just graduated from college with specialty in hotel management. I want to see her get a job, and she's not going to get one in this situation, I don't think. So we'll have to see. And I've got my sons wandering around selling and servicing electric motorcycles, and he's got to go into all sorts of different places all over the island, and that's how he caught COVID-19 in the first place. And then I've got my granddaughter and my other 2 daughters and my son-in-laws and my grandson. So yeah, personally, I want to see everybody disciplined. Went by a couple foreigners today who were, I don't know, out in Singaraj. I don't know what they were doing here. They weren't masked, and they were getting a few stares from people. So that's good news. Okay, so lots more to report today, but as I said the other day, I want to keep this to 25 minutes since I'm doing this twice a week. 25 minutes, 30 at the max, but better 25. So, good news. What Pac Santiago Uno said, he expects a surge in tourism. I don't know. Could be. There's a lot of people that want to come in. I know a lot of you want to come in that are watching these videos. And so we'll see. For now, we have to focus on the domestic tourism. And we have been, the numbers are, he mentioned, down from before the pandemic, but better now. And so, yeah, we're working on that. Let's keep a positive attitude this week, I hope. Okay, so that's it. Thanks for viewing, and wear a mask, social distance, get a vaccine that's available. See you next time.